Welcome my friends, I'm Bob Schrupp. Today we're going to talk about vertigo. I've already done a number of videos on vertigo. This is going to be a treatment for a specific type of vertigo. Now vertigo is spinning. That's the spinning sensation you get. You may get nausea along with it. You may get your eyes kind of moving back and forth. You may also have a sense of imbalance after you had the vertigo treatment or sensation. Today I'm going to show you is a treatment for people who are having symptoms to the left. That is when you roll to the left or when you turn to the left, turn your head to the left, and that's when you feel the symptoms. Now, normally if you turn to the left and the symptoms last less than a minute, we're going to have you do the Epley maneuver. I've already showed that. The Epley maneuver or the canal-lift repositioning technique for to the left. But if you're having symptoms that are lasting a little bit more than a minute, I'm not talking about symptoms that last for a half hour or an hour. That's a whole different thing. You need to see a doctor for it. But this is, if it's just lasting for more than a minute, that's a specific type of benign positional, proximal positional vertigo that you need to do something a little bit different than the Epley. Just kind of backing up a little bit here, most vertigo is caused by a BPPV, which is benign proximal positional vertigo. And those are those little canals that are in your ear. And what happens is this little debris breaks off your utricle and it goes into the canal and it just messes up your balance. So the most common treatment that we do is of the posterior canal, and it usually is the Epley maneuver. But for some, it's involving a different part of the canal, the cupula, and therefore you need to do this one. I know this is a long explanation, but basically, again, if you're having symptoms to the left and it's lasting more than a minute, not a half hour or anything like that, then let's try this one instead. Okay, so you're going to need a good surface like this, a bed, and you're going to sit up on the edge. And oh, you also need to make sure that you know what 45 degrees is. And I want to make sure that your neck can handle this. So you want to make sure that you can turn your head all the way to the left, all the way to the right, and then you can go back. I don't want to have anybody with really severe rheumatoid arthritis or cervical arthritis doing this maneuver. It just wouldn't be good for you. Or if you've had cervical surgery. So I want you're going to have to be able to turn your head to 45 degrees. So I want to make sure you know what that is. If I face straight forward, that's 0 degrees. If I face all the way to the right, that's 90 degrees. So halfway in between is 45. So I'm going to be asking you to turn your head 45 degrees to the left and to the, actually just to the right on this particular situation. All right, so you're a person, you have symptoms to the left. You're going to start off sitting up straight and you're going to turn your head to the right 45 degrees. And then very rapidly, you're going to go bring your head down and you're going to bend your head down to the bed. So you're actually bent about 20 degrees down onto the bed and still looking 45 degrees to the right. You're going to hold this position for a minute. Now I want you to keep your eyes open during the whole time. This may bring on the symptoms, but they should abate after a little bit. Okay, so you hold it for a minute, and after a minute you're going to go rapidly up, still turning to the right, and you're going to go all the way down this way. And now this time you're actually looking down toward the bed, still 45 degrees to the right, and you're going to hold this position for a minute. After a minute, you're going to sit up, and I'm going to straighten my head out, and now I'm going to give you the same advice that I give everybody after we do the canal-lift repositioning technique or the Epley technique or any one of these techniques. What we're going to do is want to keep your head up. We used to teach people to keep it up for 48 hours. We used to have people wear collars and sleep upright. We found now that that's not necessary. But what we would like to do is that you do not look down for the rest of the day. You may want to wear a soft collar. You may want to take even a rolled up pillowcase and pin it around your neck so that you remind you not to look down. But what you may also want to do is at night, because you are having symptoms to the left, I want to make sure that you don't sleep on the left side. I also, for many, we have them sleep with a couple pillows underneath them so that they are a little bit upright at night, maybe 2 or 3 pillows underneath them so they are sleeping a little bit upright. You want to do that for 2 nights. So hopefully this will take your symptoms away. Again, this is for a different type of BPPV. one that's a little bit less common, but if the other one's not working, this is one to try. Good luck to you, and please subscribe.